This is Steve Zeltzer with Workweek and Pacifica, and I'm joined now with Sal Rosselli, who's the president of the National Union of Healthcare Workers, which organizes healthcare workers in California and around the country. Welcome to Workweek, Sal.
Yes, good to hear from you, Steve.
So, Sal, why don't you talk about this campaign that you have going with other organizations around the issue of healthcare for all in California and what action you would like President Biden to take?
Sure. Thanks, Steve, for this opportunity. First of all, it's clear to us with the recent federal elections that major healthcare reform, is not going to happen on a national level anytime soon. However, we feel like we have the opposite opportunity in California, given who the governor is, and he ran on support for health for single payer, and who our legislature is in terms of some very good leaders that are in support of Medicare for all. So what we're doing is first, we've launched a petition asking Gavin Newsom to apply for the necessary federal waivers to allow California to pursue, a program, single-payer type program, Medicare for all, here in our state, and believe that within a few years we can accomplish it here, and California can be the example for the rest of the country, in getting universal health access, to quality health care. First of all, we're working through a coalition called Healthy California Now, which is a coalition of scores of organizations committed to educating and informing their constituents about the values of a Medicare for All program. And believe that eventually, whether we can accomplish legislation or a legislative program or not, it will go on the ballot before Californians, because even if we did succeed in a legislative program, the industry would put repeal on it, repeal of it on the ballot. So the bottom line is we need to organize and educate California voters about the value of it, and deeply educate folks so they can withstand the campaign of $100 million plus that the industry would spend to repeal it. Hope that gives you a quick summary.
And the pandemic has created a catastrophic situation for California workers. Millions of workers have lost their jobs. Small businesses have been closed. These workers don't have health care. Why can't the governor just declare a state of emergency and require, first of all, that healthcare companies like Kaiser and others cannot cut people loose, and also a capital tax on the billionaires, the massive wealth in California, to pay for this?
Well, I don't know that the governor has the authority to declare that kind of emergency and force providers to do that. But certainly this pandemic has shed light on on our healthcare system and how fundamentally flawed it is. When the pandemic began in March, Steve, the industry had evolved to what we describe as just-in-time inventory, just-in-time staffing, just-in-time PPE, just-in-time equipment to deal with normal situations. So no hospital, no healthcare plan was ready for this pandemic, and in fact is not ready for it today. The fact that the pandemic is adversely affecting, people of color, Black communities, Latino communities, low-income folks, is another demonstration that our healthcare system is fundamentally flawed and needs major overhaul. We need to take for-profit out of healthcare and adopt a single-payer Medicare for all type of system.
And public health in the United States, as you say, has been cut back, and the private hospital system has not been prepared for this pandemic. Are your members still fighting for PPE and protection on the job?
Absolutely. fighting for adequate PPE protection, and fighting to get tested. Folks have a hard time believing this because it's so counterintuitive. But hospital workers can't get tested today by their employers. While people in sports, professional sports are tested every day to be safe, and huge colleges are testing their entire student bodies and faculty twice a week, to be safe. But hospital workers can't get tested, and it's just because the industry's focus is on the bottom line and not, keeping patients and their workers safe.
Well, Governor Newsom was at the French Laundry with a lobbyist from the hospital industry. It seems, and also the rules that, for example, hospitals have to report workers that have COVID. Are they enforcing these rules? Because I know also as well that there's a ratio of nurse to patient, which they want to ignore. What is the enforcement of Cal OSHA, for example, of hospital locations where workers are, healthcare workers and patients?
It's abysmal. They're all, both federal, especially the federal regulatory agencies, have been so dumbed down during the Trump administration. For example, if one of our nurses pre-pandemic walked away from a patient, a pulmonary patient that she was treating, and did not dispose of her N95 mask, she would be fired. Today, N95 masks, there's not only a shortage of supply, they have to be used over and over again. We just have horrendous stories on that front. The Newsom administration, here's a specific example in terms of authority, and enforcement. In May, the Newsom administration promulgated mandatory testing regulations for nursing homes, skilled nursing facilities, because at that time almost half of the deaths were occurring in nursing homes. And after a couple of months of that, we started seeing it working. In fact, nursing homes that we represent over a several-month period, went from highly contagious with, people dying to an absence of COVID, both among the nursing home residents and the workers. So, in late summer, we started petitioning Gavin's administration to promulgate the same rules for hospitals, for testing of workers, and correctional facilities, by the way, where we also represent healthcare workers taking care of inmates. Finally, in November, the administration promulgated at all facilities letter requiring hospitals to come up with a plan for testing hospital workers on a weekly basis, right, to keep them safe. Most hospitals have not done that, and the government doesn't have the authority to force them to do that at this point. So there need to be new laws, new regulations. Again, when this first started happening in March, our union put together a healthcare worker bill of rights, a 13-page public policy paper, the changes in regulations and legislation that's needed to keep workers and patients safe. That's posted on our website, NUHW.org, and it's a long-term goal, ongoing goal now of our union to get the legislative and regulatory changes necessary to protect patients and workers in the next pandemic. But the bottom line, the big picture solution really is Medicare for all, taking profit out of the healthcare industry, taking insurance companies out of the healthcare industry.
And we're speaking with Sal Rosselli. He's president of National Union of Healthcare Workers, which represents thousands of healthcare workers in California and around the country. Well, Sal, one of the issues is Cal OSHA. In May of last year, the unions, California Fed and other unions, called on Governor Newsom to increase the staffing at Cal OSHA. There are less than 200 OSHA inspectors for 18 million workers in California. How do you explain the fact that, in fact, there hasn't been an increase in OSHA inspectors in California, which are supposed to enforce the health and safety regulations in the hospitals and other California workplaces?
Well, I can't explain it. I can't explain it in California. I certainly can blame the Trump administration for the on the national level in terms of not enforcing safety regulations. And Steve, can I talk about one other issue regarding mental health care?
Sure.
Because it's not, there are California and national laws requiring parity for mental health care, parity with medical care, but nobody does it. And before this pandemic, we've been struggling to achieve parity for mental health care for 10 years now, because we represent over 4,000 psychologists and other mental health clinicians. Well, this pandemic, before the pandemic, access to care, mental health care was woefully inadequate. And this pandemic has made it so much worse. And we, our folks know, because we've seen it in the past, with crises, once the dust settles, it's going to be explosive in terms of the need for mental health care. And on a positive front regarding, Gavin Newsom, he signed a very significant bill end of last year, taking significant steps forward, forcing providers to provide both mental health care and substance abuse care. And just a couple of weeks ago, NUHW sponsored a new bill that Senator Wiener is carrying that requires providers to provide therapy, all subsequent therapy appointments, within 10 business days, unless the clinician deems it not necessary. Today, it's not abnormal for someone needing mental health care. You get diagnosed with a mental health problem, and the first available appointments are 8, 10, often, sometimes in some places 3 months away. Can you imagine if you were diagnosed with cancer and you were told that the first therapy session is 2 or 3 months away? People wouldn't stand for that. Well, that's the reality with mental health care today. And this bill, SB 221, that Senator Wiener introduced, we hope will close that loophole.
And you've had strikes, I've covered them actually at Kaiser, for example, over the issue of mental health care and the fact that patients haven't received the proper care. Some have committed suicide. Kaiser has been fined millions of dollars for violating the law. Is there any change in these hospital chains as far as providing mental health care and clinicians and proper appointments at a quick rate so that people can get their mental health care treated?
No major change yet. The strikes that you're referring to and the contract we settled last year called for, patient care, model care committees in both Northern and Southern California that are progressing. For example, in Northern California, Kaiser recently agreed to hire another 200 clinicians to make access to care more appropriate. But it's an incremental step, Steve. There really needs to be major change in huge additional resources put into behavioral health care to achieve parity.
And profiteering in the healthcare industry, is this going on? It seems like there's a massive amount of money that's gone to the pharmaceutical industry by the federal government, and money has gone to the hospitals. Is that filtering down to the workers and the patients?
No, absolutely not. In fact, providers have realized tens of millions, some hundreds of millions of dollars in federal funds that's not coming down to help with patient care. A big abuser of this that we're struggling right now is Tenet Healthcare, a national for-profit chain that we're struggling with, particularly in Southern California, to force them to keep patients safe or test their workers. Another huge offender is the Providence St. Joseph system, which is quote-unquote a nonprofit, but acts just like the for-profits. And we have to force them to test their employees even with symptoms because they'd much rather push off those obligations to the government, right, to county departments of health, as opposed to paying it for themselves.
So you're saying your members who even have symptoms are not being tested by companies that they work for in the healthcare industry?
That's correct. And put in unsafe situations all the time. I mean, we had a worker, a phlebotomist at Santa Rosa Memorial, it's the Providence St. Joseph Hospital, who had symptoms. They wouldn't test her. We had to force. We worked with her personal physician to have her admitted to the hospital's emergency room. She'd test positive, and then they sent her a bill for it. You know, we have examples of workers that are exposed, to COVID patients, and they're told to continue to work. Examples of housekeepers, right, cleaning a patient's room that subsequently delivered COVID, without PPE and infecting her whole family. It's tragedy everywhere. Even worse than what's being reported in the press. And again, it's all because our healthcare system is focused on the bottom line, not providing appropriate and adequate care.
Okay, you were talking with Sal Rosselli, President of National Union of Healthcare Workers, and you've got a campaign going to get Medicare for all in California. What can people do about supporting that campaign?
Yeah, sign the petition. It's all over the internet. Our Healthy California Now's petition, or go to NUHW's website to access more information and the ability. NUHW.org is our website. Steve, greatly appreciate your interest. Thank you.
Okay, thanks, Sal, for joining us.